Okay. We're going to talk about oral suction for a bit. There are different types of suction that are out there. The only type that we're set up for right now is oral suction. This is suction that they go in through the mouth, do the back of the throat, so forth. There is nasal suction. They can take a small tube that goes through the back of the nose and then down into the respiratory tract from there. And then they can also do trach suctioning, which is right through a tracheotomy, and they can just go right through and suction from that. That is not something, those two are things that we don't do. There's also another kind of suction called intestinal suction, which is for the stomach or for the intestines. And this type of suction does not accommodate that. It's an internal or an intermittent suction, meaning that the suction comes on and off and on and off on a sequence to prevent ulcers and stuff from developing in the stomach. That's intermittent suction, and that's something we do not have at this time. But it is out there, so if you hear about it, you'll know what they're talking about. If they want to use this type of machine, this continuous suction for gastric suctioning of any kind, don't do it. It won't work. It will cause you problems. It's too powerful for one, and it's continuous, so it can cause a lot of damage. So we just don't do it. This machine is just designed to pull a vacuum and bring up stuff from someone's respiratory tract, back of their throat. On hospice, you'll see a lot of people, they'll do these at the end of life. They'll have the death rattle. It's more of a comfort for the family than it is the actual patient, because rarely does it really help them or prolong their life, really. It just makes everything sound a little bit better because you're getting that stuff out of the back of their throat. So a lot of times it's a big comfort to the family, and maybe not as helpful to the patient. But anyway, regardless, you should always have one of these on your van, because they will call and they'll need this now. It's not, we need this anytime today. They'll be like, I need this in half an hour. So we need to have these on our vans. You need a full, this suction this is a canister. It's got some things inside of it. So all this stuff needs to be included and wrapped up together, patient ready, so we can run. Let's break down this canister as you open this up. This one is from Drive.
They're new, aren't they?
Yeah, they are. I like the Drive one because it comes with all the bits and pieces included in the kit. So that little plastic bag we just threw away has all of this stuff here, and it has the longer suction tubing all in that little bag. So it's kind of nice and convenient. And then it also has some instructions. If you forget how to hook everything up, there's a little instruction guide there. And if the family forgets how to hook it up, leave that with the family so they can remember, because they're going to remember 2% of what you tell them probably. So let's start with this canister. The bottom is the biggest problem that we're going to have. We do not want to be sucking stuff back into this machine. And so there's two forms of protection that this has. This one, there's a float. I don't know if you can see it in the camera very well, but if it fills up, this will float, and there's a little stopper at the bottom of this that's made out of rubber, and it will plug this off and stop suction. When you deliver these are just held in by small tabs. Sometimes they can get bumped, and this little piece here will be kind of off center or be pulled out a little bit. Make sure that that's engaged all the way around. There's three places for that to engage. Make sure that that's in there snug and tight. Otherwise this will fail and it won't stop I'll tell you, the worst stuff you'll see in this job will be in this little container. It's just nasty, nasty stuff. So we don't want any of that getting back in the machine and ruining it. So this float's got to be in good shape and ready to go, so make sure that's functioning properly. And then the lid will just go right on top of the canister. Kind of a trick of the trade, if they'll put a little bit of water in this before they start the suction, it makes it easier to clean, so it doesn't get coated so bad on that bottom part. So just a little bit of water in there, or some people put some like Lysol or some cleaner of some kind in the bottom. So we want to get the lid tight. These will come in different variations. Some of them will have a bunch of different ports on them and different holes. What you need to do for what we're doing here is we need to have the top port here for the suction machine to connect to, and then this one here going out to the patient. Anything else needs to be plugged, needs to be sealed up, otherwise you won't get a good seal on everything. So we just need the suction part and this out to the customer. Sits in here just like that. With this one, it comes with a small little elbow that goes on the top, which enables that to make the curve and not kink your tubing. And then this tube goes on the end of that little elbow. And it comes with this little filter. This is your second line of defense. This is called a hydrophobic filter. If this gets wet, it solidifies, gets really hard, and will prevent that nasty stuff getting back into the machine and ruining it. If on this also, it says which side is which. It's printed on here usually. There it is. It's just printed in here. It's hard to see, but it says fluid side. So that's the side that's supposed to be toward your machine. So that will plug into here like this. And then they've got another small tube that goes on the other side of this filter that will go attach onto this machine here. This one's already got a filter on it. I don't know if you can see that there.
Oh, yep.
So what we'll do is we'll bypass, normally this would be in place here, but this is here now. So we would take this and plug it straight onto that filter. This one's not very long. If you're not long enough on the tubing, we have this 1 foot tubing. This is interesting stuff. It's called non-conductive connecting tubing, meaning that it will not conduct electricity. For some reason, suction machines can build an electrical charge and cause, you don't want to shock somebody in the back of their throat with a static discharge. So these will not conduct electricity, and a suction machine can build up a static charge on them when they're running. So it will not conduct that and to the patient. So there's a reason why they use this particular tubing for that. This 1 foot tubing, we'll pop this open. This is sterile. Until you open it, of course. If I can open it. So this shorter 1 foot tube can go on that elbow and then work straight to that filter if you need longer length. We have those here. Should have these on your van as well, just in case, because sometimes as different machines are there's a bigger space here and you don't have enough room to go there. So as that's hooked up, now the suction's to the canister. The on-off switch is here, so I'm going to turn this on. They're kind of noisy. So right now it's pulling a vacuum back into the machine through this tube, through this filter, through the hose and into this. And then the canister, this is where the suction is going to go out to the patient. So if I were to block that off, you can hear the machine start pulling a suction. And then you can increase the suction. The suction's adjustable by intensity with this knob. So it allows more and more suction to happen. You want to start with a small amount of suction and then work your way up to the amount that works. So you don't want to start real heavy when you just need a light suction. You can cause damage to the tissues in the mouth and the back of the throat if you have too much suction going on. So you want to just start low and work your way up and just to the point where it works and then no higher. So just do what it takes and don't push any further than that. So the way that you do that is this is going to turn on. This gauge here it's a negative pressure gauge. So it's pulling a vacuum. So if I block this off, you can see that start to move. And if I want more suction, I turn that knob and it's going to increase that suction. Right now that's maximum suction. And that's going to pull pretty hard. So like I said, you want to start it low and then work your way up into it. one thing you've got to keep in mind is we're trained on how to set the equipment up and how to teach the person how to use it. We are not qualified to actually train someone to suction on a patient. So there's a distinction there. We're experts on how the equipment works, so we can show you how to set it up and turn it off and adjust it, clean it and all that, but we cannot show them how to suction. So we're not going to grab the suction tip and put it in their mouth and show them how to suction. We are not qualified for that, nor do we want to. That's beyond our training. This is the tip that we use. There are a multitude of suction tips. The one that we use is called a Yonkauer or Yankauer. You'll hear them called all sorts of stuff. Yanker. I've heard them called a Yanker. The reason why we use these for oral suction is it's got a big hole in the end, and that's where most of the suction happens. Around the lip of this are small holes drilled in to that as well. So you can imagine if this gets in the side of the cheek, it doesn't create a vacuum that when you pull off, it creates a sore on their cheek. So those little holes allow that vacuum to not become like a, what do they call it, suction cup and pop that tissue and make them sore. So it causes canker sores. So these tips are designed, there's a lot more to them than that first meets the eye, but it's got kind of a bulbous tip, so it's not going to jab them and poke them.
It's smooth.
It's nice and smooth, and so it's not going to jab them either with a sharp edge. These come packaged sterilely as well. So when I'm setting these up, usually I'll just pop it open, and then we'll put the tubing from the canister right onto that and leave it in that packaging so it stays really clean. Once they use it, however, then all bets are off. They gotta start taking care of it from there. This is the longer. This is again that non-conductive tubing. This one's a 6-foot tube. This is the one that goes from the machine to the customer. And they come.
Patient rather than customer.
Yeah. They come with this little piece. Do not throw that away. We don't use it most of the time, but do not throw that away. I'll show you what that's for. So one end goes onto the suction machine. The other end goes on the end of this Yonkauer tip. And if you push and twist, it goes on a little easier, and then if they're bringing them off, if they twist and pull, it will come off. But these fittings are pretty standard on most of your tips, so if they're using a different tip from the hospital, this should still fit. So then at that point, this is set up and it's ready to go. So the nurse would come in and do some training with the family, tell them, how to suction, all these kinds of things, just for your information. Usually when they're suctioning, they will go in and suction for just a short amount of time and then break. Because if you're suctioning someone, you're going to be pulling air from their airway and they're not going to get oxygenated very well. So you can't have this suction sticking in their mouth for 60 seconds, or 2 minutes or something. You got to do this in stages. So it should be a few seconds of suction, let them recover. In fact, in hospitals, they'll hyperoxygenate someone, give them extra oxygen before they do a suction, do the suction, and then hyperoxygenate them again and test them to make sure they're back up to normal before they leave them. So there's more to this suctioning than you would think. How far to go back in the mouth and so forth, that's, again, we don't want to be involved in that, but that's going to be something that the nurses will take care of. We just need to know how to set everything up and leave it in good working order. This little piece that I told you not to throw away, this piece here, if they have one of those nose suction pieces, then this will enable them to connect those two together. So if they come from the hospital and need continuous suction through the nose, they can still do this with this fitting. So don't throw that away. Keep that, give that to the family. Say, keep this, because I've had nurses call me and they're like, this isn't oral suctioning, this is through the nose, and I don't have any way to connect it. And so I'm like, look in their bag of stuff and there should be a small little piece. And I've had people throw them away and have to go through the trash to dig them out to find them, but they're there for a reason. So don't throw them away. Let's talk about care and cleanliness of this. We're saying that some of the nastiest things that you'll ever see come through this tubing. It's going to coat the inside of this tip and your tubing all the way back into the canister, and the canister is going to get a mess. I would tell them never to overfill this by half. If they overfill this and your float fails or they hit this, their suction is done. And you're going to be running out there late at night to switch out this little filter. So to prevent that, just tell them, look, fill this halfway full and always dump it at halfway or before, but never over half. What they'll do is they'll suction, and a lot of times they won't get a lot of suction out of a lot of material from the throat and stuff, but they have to clean this. So you need a warm glass of soapy water and then swish this thing in there and make sure it's a small cup, because if it's a big cup, they're going to suction and fill this thing clear up and overfill it. That's where they overfill, is when they're cleaning this out. So they'll dip this in, bring it out, dip this in, bring it out, and do it in a small cup, and they won't overfill this. If they only have big cups for some reason, just have them watch that they don't overfill that, because it will stop it from working and cause you all sorts of problems. So after every time they suction, this is going to be coated with nasty stuff. They need to clean this with warm soapy water after every suctioning session. So this could be once a day, if they suction once a day, or if they suction 5 times a day, they're going to have to clean it 5 times a day. So when they're done with the cleaning and everything, most of the material will be out of this tubing. It'll be pretty clean. They'll take this off, take the tubing off, and they'll take this in to the toilet and pop this little piece off, and they dump that into the toilet. And then they'll take warm soapy water, pour in there, swish it, clean this out really well as well. It's a nasty job, and that stuff, it looks horrible. Sometimes it smells really bad. If it's a cancer patient, it will smell bad. It'll be really, really nasty. But it does a lot of good for them. It keeps them cleared out so they can breathe better. It makes the family feel a lot better about things and makes them more comfortable. If you've ever been in a situation, and you'll see people with on their deathbed, and they'll be having these death rails where they're dying breath. It's really, some people it's really, really hard to listen to, and it's really traumatic for patients and for their families. Yeah. And this is sometimes, hospice is as much for the family and the caregiver as it is for the patient. So we're treating both sides of that equation, and this is one of those things that comes in handy for those. So just remember, don't overfill. Teach them how to clean it well, but don't overfill it. And then do not try to show them how to suction on anybody. And if a nurse asks you to show someone, if you're on the phone with them, you're like, hey, that's all set up, and they're like, did you show them how to suction? You need to explain to that nurse, like, you know what, I'm not qualified to do that. I've shown them how to use the equipment, but I'm not qualified to do patient care. And that's something that we'll never have you guys do. So that is suction. Now, there are 2 different kinds of suction we've got. This is you plug this in directly to the wall. It's continuous, and it works well. If you need to travel, or you need to be portable somewhat, then you can take, there's a battery operated portable suction. Everything else is the same. The filters and everything attached. The canisters use the exact same canister in the tips, but just has a little battery pack on the side that functions that thing. So you can run it plugged in, but if you need to run, that's more for a child that's going to school or something like that. We don't run into it very often with hospice. But in a pinch, if you're out of this type, you can use that battery backup system, or the battery backup, the portable ones, in case this is not available. So don't be afraid to grab those battery operated ones. Okay.